All right, let's talk about something that can feel like a total headache: health insurance. Specifically, we're going to dive deep into Covered California's bronze plans and demystify what they're actually all about. Quick heads up, every number we talk about today is based on a 26-year-old living in Santa Cruz County making about 35 grand a year. So your numbers might look different. But the core ideas, the trade-offs we're going to break down, those apply to pretty much everyone. Okay, let's get into it. Okay, so bronze plans. Here's the deal. Straight up. It's all about this one massive trade-off. It's kind of like a seesaw, right? On one side, you've got the lowest possible monthly bill, which, let's be honest, looks amazing. But when you push that side down, the other side, what you actually have to pay when you get sick or hurt, shoots way, way up. It's a balancing act, and you got to decide which side you're more comfortable with. So to really get this whole seesaw thing, you got to know three key numbers. These are the numbers that truly define what you're going to be paying. So let's dive in and decode these costs, one by one. First up, the number that makes everyone's eyes pop. Yep, that is a zero, as in a $0 monthly bill. This is your premium, the fee you pay every month just to have insurance. And seeing a zero there feels incredible, right? I mean, who doesn't love free? But, and this is a big but, it is not the whole picture, not even close. And here is the catch. This is the reason that monthly bill can be zero. Meet the annual deductible. For this plan, it's a hefty $5,800. Now, I know that number sounds pretty scary. So let's break down what it actually means with a super simple analogy. Forget insurance jargon for a second. Just picture a punch card from your favorite coffee shop or, a nail salon. You know how it works, right? You pay full price for every single visit until you get all your punches, and then you finally get a discount or a freebie. Your deductible is exactly the same. You are paying 100% for your medical care out of your own pocket until you have spent that full $5,800. Only after you hit that magic number does your insurance even start to kick in and help out. Okay, so right now you're probably thinking, cool, I get it. I suffer through paying that $5,800, and then for the rest of the year, everything's totally free, right? My insurance has my back 100%? It's a really common question. Oh, if only it were that simple. The answer is a big fat nope. Sorry to burst that bubble, but that is one of the biggest myths in health insurance. Hitting your deductible is a huge milestone, don't get me wrong, but it is not the finish line. There's one more crucial number you have got to know. And this is the big one, the out-of-pocket maximum. For these plans, it's $9,800. Think of this number as your financial shield for the entire year. It is the absolute final most you will ever have to pay for covered in-network medical services. Once your spending hits this number, and that includes the deductible you already paid, then your insurance finally, for real, covers everything at 100%. It's your worst-case scenario protection plan. Okay, so we have wrestled the numbers to the ground. Now for the fun part. Because picking a plan isn't just about the money, it's about how it actually fits into your life. It's time to choose your plan's vibe. So you've basically got three flavors or vibes to choose from: HMO, PPO, and EPO. And HMO is like the gatekeeper. You've got one main doctor and you need their permission, a referral, to see anybody else. A PPO is all about the freedom. You can see pretty much any doctor you want, whenever you want. And the EPO is the hybrid. You get a ton of freedom, but you have to stay inside their specific club, their network. Now, those definitions are fine, but what do they actually mean when you need to use them? Let's make it real. We're going to put these plans to the test with a real-world scenario that I'm calling the basketball test. Okay, so picture this. You're playing some pickup basketball. You go up for a rebound, land funny, and ouch. Your knee is not happy. You're pretty sure you need to see a specialist, like an orthopedist. So what happens now? Well, that depends entirely on your plan's vibe. First up, the HMO path. This is our $0 a month Kaiser plan. Remember that gatekeeper vibe? This is what it feels like in real life. You can't just Google an orthopedic surgeon and book it. Nope. Step 1, you have to call your main doctor, your primary care doc. Step 2, you go to that appointment. And if they agree you need a specialist, they'll give you a referral. And step 3, only then can you finally make an appointment with that knee specialist. It's a process. Now, let's switch gears to the PPO path. This is that Blue Shield plan that costs about $174 a month. Its vibe is freedom. So, your knee is busted. What do? Well, check this out. Step 1, Call the specialist directly and book it. That's it. You're done. No gatekeeper, no referrals, no extra steps. That convenience and direct access is what you're paying more for each month. But, and you really got to listen to this part, that PPO freedom comes with a huge warning sign. One of the main perks is that you can see doctors who are out of network. But if you do that, you're playing a totally different game with a separate and way, way higher deductible. For this plan, it's a shocking $12,600. So, pro tip, even with a PPO, staying in network is almost always the key to not going broke. And that brings us to our third option, the EPO. This is the Blue Cross plan, the most expensive per month. This is that hybrid vibe we talked about. You get the awesome freedom of a PPO. You can call that specialist for your need directly, no referral needed. The catch? You absolutely must stay within their specific network of doctors. If you go outside of it, unless it's a true life or death emergency, you're paying for all of it yourself. It's freedom, but with a fence around it. Okay, we've covered the costs, we've covered the vibes, so let's wrap this all up by asking the single most important question. After all this, what is your number one priority? Let's do a super quick recap. It really just boils down to this. If your absolute top priority is the lowest possible monthly cost, the HMO might be your jam, as long as you're cool with having that gatekeeper system. If what you want is total flexibility to see any doctor anywhere, anytime, the PPO offers that freedom, but you gotta be willing to pay for it. And if you want a little bit of both, the EPO gives you that PPO-style freedom just as long as you stay within their network. Look, we've just scratched the surface today to get you started. Before you sign on the dotted line for any plan, you have to do one more thing. Find the official document called the Summary of Benefits and Coverage. Seriously, this thing is your Bible. It has all the nitty-gritty details about copays, what's covered, what's not. It is the only way to know exactly what you're getting into. Do not skip this step. So that's the breakdown of the bronze plans. In the end, it all comes down to this one simple question. What do you value more? Keeping your monthly bill as low as humanly possible, or having the total freedom to choose any doctor you want, no questions asked? Your answer to that is going to point you right to the perfect plan vibe for you. Thanks for tuning in.